A typical IVF process or a typical IVF cycle is over 1 month. So it's supposed to replicate what our menstrual cycle is like. In our natural cycle, we tend to release 1 egg every month. That's ovulation. But in an IVF cycle, we are inducing superovulation. So what that means is the same hormone that is produced by your ovaries, we are amplifying that safely. The ideal would be to be able to stimulate all the follicles that are available on the surface of your ovary so that all of them will grow to become the dominant follicle. Usually you only get 1 dominant follicle, but in an IVF cycle, we want to get many, but not too many, because that may make you sick, with what we call ovarian hyperstimulation syndrome. So we will tailor the medication dosage. They usually come in pen forms. There's many brands, many types, but the essence of how we use them is very similar. We dial it to a dosage that we think is the most suitable for you. And it's a very tiny needle, kind of like an insulin needle. It is a daily injection. After about a week or so of these injections, we'll get you to come in for a scan to see how your ovaries are responding to these injections. Once we measure the follicles to position, we'll go, yep, now the timing is right for us to trigger. About 36 hours after that, we come in for an egg collection to collect all the potential eggs that are in those follicles that have been growing. That timeline is about 2 weeks or so, which again mimics your natural ovulation. After we collect the eggs, we fertilize them together with the sperm, either via IVF, which is putting a dollop of sperm together with eggs, or if there's any sperm factor involved, then our scientists in the laboratory will then choose the sperm that is the best looking. So the one that swims the best, the one that looks normal, to be injected into the egg itself. That process is called ICSI. The day after that, we'll get to know how many of those eggs have successfully been fertilized. They get watched in this incubator that is smart with AI, time lapse. We don't even need to move the embryos out. They get kept in this controlled temperature, gas, oxygen environment, and we just look at them growing over the next 5 to 7 days to this stage called a blastocyst, and then we choose the best looking one to put back into the uterus, and that process is called an embryo transfer. Again, that's kind of like a pap smear. Then comes the 2-week wait that everybody talks about to find out whether we are pregnant or not. And that whole cycle is 1 month.